General Sohail, before you step out, just want a quick point of view. You initially started off saying that we have these stents and we can go up by 1.25 or 1.5. I take that with a very big pinch of salt. Tell you why. When you go up by 1.25 or 1.5, usually these stents, most of these stents, do not have this in their recommended by the company. They normally say 0.5. That's where you are legally covered. After that, you're not legally covered. Second point is, whenever these stents are pushed beyond a certain 0.5, there is going to be a longitudinal shrinkage. That longitudinal shrinkage, you do not know which end is going to be pulled more. Then again, once they're being pulled down, because these stents are now somewhat opposed, so you are going to end up pulling some endothelial lining along with it, and that may have another injury factor behind it. So my humble submission is that whenever a person wants to go ahead and consider using a stent, firstly, please see whether the manufacturer has permitted it or not, point one. Number two, once you do that, the helical design that these stents are supposed to retain, because that gives it that structural strength, that has changed. So will that be maintained or not? Again, something which industry will tell you whether that is going to happen or not. And then again, once you're going to pull it back, especially if you are trying to nail the left main and you're not really thinking of hanging your stent out by a millimeter and you really want to do a close job, then you have got a problem coming up. My simple submission and point.
You know, in medicine we have the aggregators and the segregators. And then we have who are clarifying and who are, you can confuse a lot of things. Whatever I've said is based on data, and the diameters of expansion of Zeiss which tell you are on the IFUs. So nothing is out there, and a lot of almost all the left mains which we do now are IVUS covered, and they expand just the way they're supposed to. And in last 5 years, we've used so many stents, I'm not sure how many. I have not seen a single longitudinal shortening, and if I expand within a certain limit in my IVUS, we've never seen, never obviously means hardly ever, seen a stent being shattered, broken, or torn apart. I have a lot of reservations about so much talk about the very thin struts, because you need a little radial strength also, and the proof of pudding is in the eating. And of course, the new stents are going to have lots of advantage. I'm not saying one is worse than the other. All I'm saying is that when you become, there is the data will suggest what it is. Any stent which has a good clinical outcome will be a good stent. That's the proof of the pudding. So too thinner struts is not an advantage. It will produce longitudinal shortenings and trauma and disruptions. But I think there is a sweet point somewhere in there, which probably is around 70, 80 millimeter. And even if you take those brands which have a thin strut, they are thin in up to 2.5 and 2.75. Once they cross 3.5, they become 80 millimeter again. So much for the thin strut. So IVUS has shown that at least the case we've done, there's no longitudinal shortening and there's no disruption of the struts. And whatever diameter I suggested, 2.25 can go up to 3.5. Why does that happen? That happens because you were like 5, 6, 7, 8 sizes. They don't make one stent 2.25, another 2.5, another 2.75. They will take a 3.5, shrink it down, crimp it on a 2.5 balloon, 2.5. So the balloon changes, the stunt. There are only two sizes of Zeiss. One is which is can be expanded to 3.5, which 2.5 can go up to 3.5, and then a 3.5 which can go up to 5.5. So they've got just two stents which are mounted on different balloons. So that's how they have so many sizes. They can't have X number of sizes. Thank you, sir.
I remember in previous days there used to be a stent from Boston. It had, besides chromium, another element. and that was responsible for shortening, which has been long discontinued.
Yeah, I
Now
think
it's not a
chromium
question.
cobalt is the trendy one. Then they had platinum, and
Right.
they also had a nickel one.
Yeah.
But the nickel one had so many allergies that they had to withdraw it.
Yeah,
Yeah. Yeah. These alloys can be much thinner than stainless steel. So now is the days of alloys. G, of course. But there's a trade-off. If you make a very flexible stent, it'll be thinner and it'll lose its radial strength. So you need to have that sweet spot where you get both trackability and radial strength.
But what you have to look at what the manufacturer says. If the manufacturer does not say it and you do something, please remember you are legally not covered. That's my point.
What is not being legally covered?
So when a manufacturer says that my stent can be go up to by 0.5, there are Boston stents, the Promus for example, has a 0.5 limitation. You tip
What is 0.5?
0.5 millimeters.
Point?
0.5.
0.5?
0.5 आप
Millimeter.
3.5 को वो कहते हैं 4 तक लेके जा सकते हैं. That's what there legally it says. You push it up by to 4, you have a stent fracture, it is not covered. I've had this problem, that's why I'm pointing it out.
I think you
put
made a
my
very
2 cents in?
valid point. Just you must understand the stent you're using. You just can't say, "Give me this, I'll try it." You must
Can I-
see all the expansile. So for me, the best stent for left main is, unfortunately, I can't help but saying it's a Zions. For left main, there's enough data to suggest that
Yeah.
you're just outstanding.
Yeah, I think both of you are right in a way, actually. Legally, yes, there can be a problem because you cannot go beyond manufacturers. But in practical life, sometimes you are just stuck up and you end up doing that. So I think we have all done it. I have done it so many times. And why we insist that it can be done is because we are lucky enough to see that patient get away with it. It's not that purposely we have done it, it's the patient's luck. And I agree, if you undersize, there are problems. But having said that, I just recalled a patient जिसको 3.5 में किसी ने 2.5 डाला हुआ था. And every 2-3 years I did a cath, it was still patent. So it's patient's luck also. But yes, I mean legally, I think we should avoid doing that purposely. But sometimes you are stuck up, you can only use one stent, and the distal vessel is lower side, so you can't help it. We all end up doing that.
Sorry,
Sir,